You might feel perfectly fine, yet inside your body, a silent force could be slowly damaging your heart, brain, and arteries. High blood pressure is one of the most dangerous health conditions, yet most people have no idea they have it until it's too late. Could your body be sending you warning signs that you've been ignoring? Today, we'll uncover the early warning signs of high blood pressure that most people overlook and how you can detect it before it leads to a life-threatening crisis. Welcome to Levitas. Why is high blood pressure known as the silent killer? High blood pressure, or hypertension, is called the silent killer because it often causes no noticeable symptoms while quietly damaging the body. Over time, excessive pressure on artery walls can lead to heart disease, strokes, kidney failure, and even vision loss, often without any warning. Many people live with hypertension for years without knowing it, assuming they are healthy simply because they feel fine. This is why regular blood pressure checks are essential. By the time symptoms appear, the damage may already be severe. But if you know what to look for, your body may be giving you subtle signs that something is wrong. Can fatigue be an early warning sign? We all feel tired sometimes, but if you're constantly exhausted despite getting enough rest, high blood pressure could be to blame. Fatigue is often overlooked as a symptom of hypertension, but it happens because your heart has to work harder to pump blood, reducing oxygen and nutrient delivery to tissues. Over time, this strain can lead to chronic exhaustion. Hypertension also affects the tiny blood vessels in your brain, leading to poor circulation. When your brain isn't getting enough oxygen, you may feel sluggish, mentally foggy, or drained for no apparent reason. Additionally, high blood pressure can contribute to poor sleep quality, worsening fatigue even further. Another factor? Hypertension can damage the adrenal glands, leading to hormone imbalances that cause fatigue. If tiredness persists, and especially if it's paired with dizziness or shortness of breath, it's worth checking your blood pressure. Unlike common tiredness from stress or lack of sleep, fatigue from high blood pressure doesn't improve with rest and often lingers despite lifestyle changes. If you're constantly exhausted, your body might be warning you of an underlying issue, and hypertension could be the culprit. Does hypertension always cause headaches? A common myth is that high blood pressure always causes headaches, but this isn't entirely true. Most people with hypertension experience no pain at all, especially in the initial phases. However, in some cases, high blood pressure can trigger headaches, particularly when it reaches dangerously high levels. Why does this happen? Severe hypertension can cause increased pressure inside the skull, leading to a throbbing headache, often felt at the back of the head or behind the eyes. These headaches tend to be more intense in the morning and may worsen with physical activity. Another cause is the effect of hypertension on blood vessels. High blood pressure can lead to vascular instability, where blood vessels expand and contract unpredictably. This fluctuation can trigger headaches, particularly in people prone to migraines. That said, headaches alone are not a reliable indicator of hypertension. If your blood pressure is consistently high and you start experiencing persistent, unexplained headaches, it's time to take it seriously. A headache combined with other symptoms like dizziness or nosebleeds could signal dangerously high blood pressure that needs immediate attention. Are vision changes a red flag? Yes, changes in vision can be one of the most alarming yet overlooked warning signs of high blood pressure. Your eyes contain tiny blood vessels that are highly sensitive to fluctuations in pressure. When blood pressure remains high, these delicate vessels can become damaged, leading to vision problems. One condition, called hypertensive retinopathy, occurs when high blood pressure causes blood vessels in the retina to thicken or leak. This can lead to blurred vision, double vision, or even sudden vision loss in severe cases. Some people notice dark spots, floaters, or difficulty focusing, which may seem like minor annoyances but could be warning signs of underlying hypertension. Another issue is optic nerve damage, where reduced blood flow to the eye can lead to gradual vision deterioration. In extreme cases, uncontrolled hypertension can even cause bleeding inside the eye, leading to permanent damage. If you notice persistent vision disturbances, especially if they appear suddenly or worsen over time, don't ignore them. Your eyes might be revealing a serious underlying issue, one that could affect not just your sight but your overall health. Have you ever noticed a constant ringing, buzzing, or whooshing sound in your ears that just won't go away? This could be pulsatile tinnitus, a condition linked to high blood pressure. Unlike regular tinnitus, which can result from noise exposure or ear damage, pulsatile tinnitus occurs when blood flow becomes turbulent due to increased pressure in the arteries. High blood pressure can cause changes in the delicate blood vessels near the inner ear. When blood is forced through these vessels at higher pressure, it creates a rhythmic or pulsing sound, often in sync with your heartbeat. This can be incredibly distracting and even interfere with sleep and concentration. Additionally, hypertension can reduce oxygen supply to the auditory system, leading to nerve damage and further worsening tinnitus symptoms. If you experience persistent ringing or pulsing noises in your ears, especially if it's accompanied by dizziness or headaches, it could be a warning sign that your blood pressure is too high. Ignoring this symptom could mean missing an opportunity to catch hypertension early, before it leads to more severe complications. Can nosebleeds indicate high blood pressure? While occasional nosebleeds may be common and often harmless, frequent or unexplained nosebleeds may be linked to high blood pressure. When blood pressure rises, the tiny blood vessels inside the nose can become fragile and prone to breaking. This is especially true when hypertension causes sudden spikes, increasing pressure on these delicate capillaries. However, not everyone with high blood pressure will experience nosebleeds. They are more likely to occur in cases of hypertensive crisis, where blood pressure reaches dangerously high levels. If you frequently get nosebleeds without an obvious cause, it's wise to check your blood pressure. Is poor sleep a consequence of hypertension? Yes, and the relationship between poor sleep and high blood pressure is a two-way street. Hypertension can disrupt sleep by causing nocturnal blood pressure spikes, leading to restlessness and frequent awakenings. Additionally, high blood pressure is closely linked to sleep apnea, a condition where breathing repeatedly stops during sleep, leading to poor oxygenation and increased cardiovascular strain. On the flip side, chronic sleep deprivation can also raise blood pressure, creating a vicious cycle. If you struggle with insomnia, frequent nighttime awakenings, or unrefreshing sleep, it may be time to monitor your blood pressure levels. What's the best way to detect early hypertension? Since high blood pressure often has no symptoms, the only reliable way to detect it early is through regular blood pressure monitoring. Home blood pressure monitors are widely available and easy to use, allowing you to track your readings consistently. Ideally, check your blood pressure at the same time each day in a relaxed state and compare your results over time. Additionally, annual health checkups are crucial. If you have risk factors like obesity, stress, or a family history of hypertension, regular monitoring is even more important. Early detection allows you to take control before hypertension leads to irreversible damage. In conclusion, high blood pressure is a silent but dangerous condition that can go unnoticed for years while quietly harming your body. Though it often lacks clear symptoms, subtle warning signs like persistent fatigue, vision changes, buzzing in the ears, and unexplained nosebleeds may indicate an underlying issue. While headaches and poor sleep are sometimes linked, they aren't always reliable indicators. The best way to catch hypertension early is through regular blood pressure monitoring. Don't wait for symptoms. Checking your blood pressure routinely can help you take control before serious complications arise. Thank you for tuning in to Levitas. Please share today's video with friends and family. Give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.